Good morning, everybody. Welcome to our Spirico webinar. So we have myself, my name's Chris, and I'm the Client Director for the UK and Ireland. And I'll be joined by Lisa Jane Humphreys, who's our International Client Director. Both of us are from a social care background, as a lot of the Spirico employees are on the project side and on the client-facing side. So we understand the challenges and the expectations on the social care sector. And you can look us up on LinkedIn if you want to just follow what we've been up to, get some info on our latest products, latest projects, and some other, and everything else that's going on. So today's webinar, we're just going to be looking at our software technological solutions, particularly in the supported living sector. So our previous webinars, sort of the series that we had last year, were looking at how technology can support social care providers during the pandemic, the unique set of challenges and circumstances that the pandemic threw up. But now we're trying to avoid the dreaded P word. I think we're looking at moving out as we're emerging from the pandemic, as we're sort of getting something close to approaching normality over the next couple of months. So the next series of webinars and some other activity we've got going on, we'll be looking at how does the social care sector move forward? What have we learned over the last 18 months? Where can we go now? And also what role technology can play. So we're starting with supported living. So that could be learning disability, mental health supported living settings, as well as in aged care. People often forget about aged care within this sort of context. For extra care housing, the structure the structure and operational organisation of extra care housing is actually very similar to residential supported living, accommodation-based supported living. And of course, we also have community-based services as well. So the next sort of couple of webinars and things is what we're going to be focusing on. So when you're managing a supported living environment, a supported living setting, regardless of what service user group you're working with, obviously the core, the centre of everything is your care and support planning. But also, there's a lot of other factors to consider. Your quality and compliance needs to be maintained, needs to be monitored, needs to be evidenced. We have location management, outside of individual services. You still have, you have health and safety considerations, inspections, equipment, all sorts of things going on, as well as managing that location in terms of shift handovers and things like that. You have incident management, which is another big area for things that happen outside of the norm, events and incidents that need investigation, need monitoring. Stakeholder involvement as well. So you're not just managing a service and trying to, for the individual supported. You have friends and family involvement, as well as your professional colleagues from health and from social services, and a wide range of other people are involved. And with government plans and things, we were looking at a more integrated system in time anyway. So that's becoming more and more important. Obviously, you want to be able to report on what you've been doing and evidence all of this activity. And of course, we're looking at integration, not just from an organisational point of view, but also systems point of view. Increasingly, as people look for digital solutions, you have your care planning side, but also you may have, particularly in supported living environments, you have various monitoring devices fitted around buildings and things. It's quite common now, but also you might have HR systems and finance systems. But what we're going to look at today, we're just going to focus on the fundamentals. We're going to be looking at care and support planning side of things to start with. We'll look at some of the other elements in other webinars. So that support service cycle that we're looking at, the fundamentals, the core of what we're all in the sector for. We've got support planning, support delivery, support monitoring, and then support review. So when you're looking at planning, you're looking at the individual's needs, you're looking at their outcomes. Then at delivery, you're looking at monitoring your service activity. And then once you've sort of delivered that service, you've monitored it in real time on a regular basis. You'll want to review what you've been doing, what's working, what's not working, and things, and really look at embedding a culture of continuous improvement. So we're going to be looking at iPlanet today on how iPlanet, as a care management software, as support management software, how those core fundamentals are addressed within the software system, and also the main, what we're finding as we emerge from the pandemic, and we've had a huge increase in inquiries and interest in the system, is making sure that the person is at the centre of all of this. People are now starting to move away from a time and task model. People are starting to move away from legacy systems and paper-based systems, and looking at how we can build resilience for the future, how we can improve our services whilst keeping the person right at the heart of everything we're doing. And that's where iPlanet comes in.